Well, good afternoon, everyone. My name is Gary Blau. I'm the Chief of the Child, Adolescent, and Family Branch of SAMHSA, the Substance Abuse and Mental Health Services Administration. And we want to welcome you to KSOC-TV, where we share timely, relevant information on issues related to the mental health needs of children, youth, and families. Now today, as we begin the month of the military child, and hence we're wearing our purple to support our military families, we are going to be looking at the mental health needs of children, youth, and young adults in the U.S. military and their families. Currently, there are almost 5 million people, including active duty personnel, reservists, and their family members who make up this group. 2 million of these are children. And while as a group, these children are pretty resilient and well-adjusted, they can also experience emotional and psychological challenges that are different from their peers in non-military families. Understanding these issues and ways to help military families is what our panel will be discussing today. I also want to take a moment just on a personal level to say thank you to our military service personnel for your service to our country and for your sacrifice. And it is a great honor for us to be able to share some of these resources and information today. And if you're really interested, we are going to invite you to be part of our discussion. You can join our conversations in 3 ways. First, you can tweet your questions using hashtag KSOC-TV. You can click on the Ask a Question icon on top of your screen, or if you're brave, you can call us at 1-800-527-1401. We also want you to know that if you're concerned right now about someone who may need behavioral health support, that you can contact the SAMHSA Lifeline, where help is available 24 hours a day, 7 days a week. Service members and their families can contact Military OneSource at 1-800-342-9647 or the Be There Support Call and Outreach Center at 844-357-PEER, P-E-E-R. So our conversation is ahead, but first, let's set the stage for our discussion today with a closer look at this topic. Here's our KSOC-TV Focus segment.
We begin our discussion with a look at the data. Of the 2 million children who have a parent or caregiver in the U.S. military, 44% are younger than 5 years old. Nearly a third are between 6 and 11, and almost a quarter are adolescents. Their lives are typically filled with change. Among active duty service members, for example, a child moves 6 to 9 times between kindergarten and high school graduation. Not since Vietnam have so many military families been affected by deployment-related family separation, combat injury, and death. Since 2001, 2.7 million service members have been deployed to Iraq and Afghanistan. Roughly half of them served there more than once. Frequent deployments by their parents and caregivers can put some children at risk for emotional and behavioral challenges. Other risk factors include not living close to a military community or having limited resources. The reactions to deployment vary by age, developmental stage, and other individual and family factors. Younger children might exhibit anger or have trouble paying attention. School-age children often internalize their feelings of anxiety and fear, reducing their school performance. And adolescents are more likely to experience depressive symptoms and behavioral problems in response to emotional stress. The duration of parental deployments has emerged as a major influence on families and children. The longer the parent or parents are away, the greater the stress on home life and the more difficulty children are likely to experience in engaging with the parent or parents when they come home. Military personnel returning from combat deployments are at greater risk of increasing stress for the child and family. What about those children whose parents don't return? Since 2001, thousands of military children have experienced the death of a parent or caregiver as a result of their service. These children may develop traumatic grief responses, and mental health issues may develop or worsen. The reactions of some children and teens to the death of a parent or someone close to them can be more intense than just deep sadness or grief. In some cases, children develop symptoms associated with post-traumatic stress, or PTS, including intrusive thoughts, emotional numbness, being easily startled, or developing new fears. Perhaps the biggest challenge of all is to make sure military families have access to mental health services and know that reaching out for help is okay. One way to do this is through military peer specialists. Military peer specialists are certified professionals who help service members navigate the mental health system to locate resources and benefits. These specialists can also help address any stigma a service member may feel related to a mental health challenge that they or a family member may have. Because military families may seek help in the community, professionals in healthcare, family service, education, recreation, and faith-based services can help by becoming familiar with the specific culture and risk factors that are present for military families. Understanding how these experiences can affect a child's health and development helps child-serving professionals provide direct services, support the family, build the family's resilience, and promote physical and emotional self-care. Our military families have sacrificed a lot for our country, so finding effective ways to help these families is something we should all do. Time now to begin our discussion. Back to our host and our distinguished panel.
Great. Well, I'm really excited to introduce that panel right now. First, we have Captain Edward Simmer, who is the Defense Health Agency's Chief Clinical Officer for the TRICARE Health Plan. We're also joined today by Rachel Conley, a United States Coast Guard spouse, parent, family advocate, and ombudsman. And from SAMHSA, Catherine Power, who is currently the Acting Director for the Center of Substance Abuse Treatment and the Senior Executive Lead for service members, veterans, and their families, and herself a military family member. I want to welcome to you all, and I'm really glad you're here today for this important discussion. Rachel, let me start with you. We saw the roll-in, and you know firsthand what it's like to be part of a military family. So maybe if you could sort of talk a little bit about that experience, some of the stressors that were mentioned in the first segment, and how that's impacted your family.
Right. Well, that was a really powerful piece, and I enjoyed watching it. As a military family, we really love this life, but that doesn't mean that it's free of sacrifices. Things like frequent moves, deployments or separations. Our family has experienced a little over 20 of those, ranging from 2 to 3 months to a year in the Middle East when my husband recently deployed there. Changing medical providers as we talk about special needs children or children who have mental health needs. That's a challenge once you establish care and then you're having to transition to somebody else. These are common things that our military families face with really great bravery, and I'm thankful to be part of this community.
And you mentioned 21 moves?
Deployments or separations, that's right.
And how old are, if I may ask,
yes,
your
so,
children?
We have a 15-year-old, a 9-year-old, and a little girl who just turned 4.
Mm-hmm. And have you seen like any differences between them, or how they reacted? How do you kind of help them with these deployments?
Absolutely. Well, in a lot of ways, I feel that it starts with me. I feel like I set the example. So I want to make sure that as we enter these periods of more stressful situations, like leading up to a deployment or experiencing that they can look to me as a sense of strength and stability, and we hopefully live this life with grace, perspective, and positivity whenever we can.
Mm-hmm. And what do you do to help take care of yourself during these times? Because
Right.
It would seem like, for you're taking care of everybody else, but what about yourself?
Right. Absolutely. Caregiver burnout is a really major thing that a lot of our military families face, our military spouses. I think it's important to be surrounded by a really great support network. You may not always be near your own family, but often the friends that you meet become family. Do something that you love. Find a passion. Mine has really been this community, serving this community, and that is a really rewarding experience for me. So I pour myself into the things that I love and caring for my family.
Okay. Catherine, you're also from a military family, have a military background.
Yes.
And you've been supporting military families as part of your work at SAMHSA for, I know this, as over 14 years,
Yes.
because I will just share the audience. Catherine Power hired me a number of years ago.
My greatest claim to fame. Gary.
Oh, well, I appreciate that. Can you talk a little bit about how these inherently stressful elements that we've seen on military life can actually contribute to mental illness?
Certainly. And I actually want to take the perspective that Rachel started and to say that depending upon your experience in the military, there is a different set of conditions and stressors that you realize. And I will tell you that from my own experience, I grew up in a military family, so that's a first set of conditions that you might want to explore. And then I married a man in the military, so then I was a spouse who was also a member of a military family, and that was a second level of conditions. And then I myself became a member of the military. So you sort of straddle these three populations. You're a military member of a family as a child whose parents are in the military, you are a spouse of a member of the military, and you yourself are a member of the military. So there's an interesting combination of those stressors that affect, I think, those three sectors that I think are very important to differentiate. I think also what I have found is that the basis for a lot of our discussions about mental health in military families and children is rooted in the fact that we generally believe that military families are highly resilient. We generally take the approach that because of the military community and because of the military experience, generally we have high resiliency factors in and across the military spectrum. But your question about what are these stressors and what could they lead to is an important one. Because when you looked at the age of the children in the video, you begin to understand that you have to be very cautious and observant about what is happening to that military child. What is that child experiencing in the ages 0 through 5? What is that child experiencing in terms of feeling a sense of stress, a sense of anxiety, a sense, frankly, of depression? You look at the next age group of adolescents, and there are adolescent changes going on anyway, never mind if you have a military experience. And that was actually, my experience was that we had 5 kids in my family. You know, we were all experiencing adolescence in different ways, and my father was off doing things that were important for the country. And so how do you deal with that in terms of being able to sort through? So those are the times when you have to be very cautious and careful. What is the school behavior? Are we talking at night about what's happened? Are you getting along with the civilian counterparts in the schools that you're attending? Do they know who you are? Are you treated any differently because you are a military family member? All of those things can lead, if not addressed, to much more serious psychological distress, to much more serious sense of isolation, to a much more serious sense of dislocation, much more serious sense of not having a community around you. As Rachel talked about it, I went to 8 grammar schools and 6 high schools, and I survived. We can survive, but we have to pay attention to it. Your family has to pay attention to it, and you have to learn, frankly, when you talked about the positivity, Rachel, you have to learn how to say, oh, I'm not alone. I may have a different life than other people, but I'm not all by myself, and I have something to support me.
Well, and you said several things that I think are incredibly powerful and meaningful. At first is the intergenerational component in many families, because we see many generations having service. So there's this whole dynamic across generations and how to address that. And a pride. And in addition, you talk about that sense of resilience, and that for the most part, there is a culture of resilience.
Absolutely.
And that ultimately that there can be, at the same time, challenges that occur. And a young person who may be struggling at a young age, who's internalizing, a teenager who may act out potentially if they're feeling somehow disconnected, as you were saying. So all of those things are so critical. And so let me ask Captain Simmer, you're the Chief Clinical Officer for TRICARE, which the military's healthcare system. How do you help families address some of these stressors?
Sure. Well, first, we start before the family actually deploys. And I think when we talk about a service member deploying, we should think about the family deploying too, because even though they may physically still be home, the deployment's affecting the entire family. So we start before the family deploys, as I said. We train the family, we train the parents. I think you talked a little bit about that, Rachel. Making sure that the family members who will be staying behind, the parent who will be staying behind, knows what to look for with the children, knows these are some of the warning signs that you'll see. And this is some of what's normal too. Because, Catherine talks about the family surviving. We certainly want that, but we really want them to thrive. We want to see the family thrive across the deployment and then beyond. During the deployment, there's family support groups. I think that sense of community that you mentioned is really important. The medical system has a role to play, but this has to be the whole community playing a part. So we try to get them linked up with other family members who are going through something similar or who have gone through something similar in the past for support. I think that's very important. We have some non-clinical counseling services like Army Counseling Service, Navy Fleet and Family. I think those can play a big part as well, in both in the education and the one-on-one work, because every family's different. Every family will have different needs, and we need to meet that family where they are, whenever they are. And then the big part is, what do we do when the service member comes home from deployment? We often see the greatest stress after the homecoming, because after 6 months, after a year, the family has changed. Roles have changed. The spouse who stayed behind has assumed new responsibility and may not want to give that up so easily. And rightly so, because they've shown they can do it. So the service member coming home needs to be ready for that and needs to understand how to best integrate back into the family. So one of the things that we do is we actually do training and work with the service members before they come home, a month, a few weeks before they come home, so they know what to expect and how to make the homecoming as successful as possible as well. And I think when we do all of that, both across the medical side, and certainly we do have medical services available, mental health services available, so if the children are having, particular problems, some of the mental health issues you mentioned, we have treatment available for that. But a lot of this is really doing the preparation and the prevention work, so we don't need that.
Gary, I think one of the things that the doctor mentioned that I thought was so important is that we have to teach people what is normal.
Yes.
And I've often found that there's a disconnect between what people think is a normal range of behaviors and emotions and what is actually an extended normal range of emotions. So for example, every time we have a disaster, we are always convinced that we are watching a normal range of behavior, but people are behaving in ways that we might have never seen before. So the same is true, I think, in military families. We have to talk about, well, we have an expectation about what is normal, but let me tell you that what the military family experiences is not the norm. And so the acceptance of a larger continuum of acceptable normal behavior is a really important framework to have when you have a conversation with these families.
Which is also a good point when you're thinking about what that normal is. And you mentioned about warning signs, as you were saying. Can you give us some examples of what you would see as something that if we have an audience member at home who's concerned, what should they be concerned about?
Well, I think as the opening described very well, it varies by age. For a young child, 5 years of age or under, basically before they enter elementary school, you'd be looking for things like regressive behavior. So what I mean by that is, perhaps things that they were doing. They were potty trained, and now they're having accidents, or they're, they were playing a lot with their friends in an effective way. Now either they're getting more angry, or they're withdrawing. So if you see a significant change in behavior in a young child, that's certainly a warning sign. I think as you move on to older children, who are in school and spending a lot of their time in school, I'd look at, are they declining in school performance? Is their academic performance declining? If they were in extracurricular activities, have they lost interest in those? Do they look depressed? An adolescent can tell you that. If you've got a good relationship with your child, they may be willing to tell you that. or others may observe that, their teachers, for example. So I'd certainly be opening lines of communication to the teachers and saying, are you seeing anything different in my child? I think, making sure that you're getting that input and you're looking for things like changes in behavior, withdrawing, anger, those kinds of things, I think, are warning signs that would tell a parent they should take some action.
And we can also look at very simple, observable things like eating patterns, sleeping patterns. Not even just, it doesn't even have to be a negative behavior. It can even just be a significant pattern change.
Yeah, absolutely.
And I think my mother actually used to keep notes. She had 5 kids to watch, right? So she's keeping notes about, so what's going on. And I think that was the way she kept herself sort of stable and watching all of us, progress forward. She never shared the notes with anybody, but I think there's just a way that you can observe simple things, Doctor. I guess that's what I mean.
Yeah, absolutely.
And of course, then there's the bigger things. Obviously, substance use and your teenage, things like that that would warrant, some kind of intervention, and then getting help has always been sort of a question. One of the things that had happened in our lead up to today's webisode and getting information about it is that some families and service members are actually a little concerned about seeking mental health treatment. We've been told that there's fearfulness about how a career could be damaged in some way. Do these same kinds of concerns hold true for family members as well? Rachel, I'll ask you.
I certainly hear that. I think that's a frequent concern, a common question that I've received in the past. And first and foremost, I want to encourage everyone who needs help to seek that help. Our top priority is truly the well-being of our service members and their families. So I never want anybody to hesitate to get the help that they need. Support is definitely available. Resources are available through TRICARE, through your individual services, through the family support professionals, our chaplain network. Reach out to somebody. Our service members and their families are very, very committed to service. They don't want to risk this career, this lifestyle, but I think the most important thing is their safety and well-being, and I always encourage that they get the help they need.
And it certainly seems, and we've heard our military leadership talk about the importance of getting help, and that it will not affect one's career, although I think people are still, there's sort of these deeply held beliefs about the culture. Let me ask, Captain Simmer, what can providers and military leaders do to help address some of those deeply held concerns?
Sure, and I think that's a great question. I think first they can train their personnel. Explain to them this is what going to mental health means. This is what it doesn't mean. There are many examples where someone goes to get needed mental health assistance and they come back as a better sailor, soldier, airman, and more effective. And leaders see that and encourage them to get help because they know that that's going to end up with better work performance too. And they want to take care of their personnel, and that's one way they can do that. So I think part of it is the training. I think part of it is the experience as you see people coming back and doing better as a result of treatment. I think that's very important. I think a third part, especially when we talk about family members going and getting treatment, is giving examples where where people have gotten treatment and it has not resulted in harm to a career, either a civilian career or a military career. And there are many examples of that. We see, in the Marine Corps where they've looked at the folks who've been in the Exceptional Family Member Program potentially for mental health issues or other issues. And in fact, those Marines have longer careers on average and do a little bit better in their careers than folks who are not in the EFMP. So I think, there are some myths out there that mental health problems can harm a career. Family problems can harm a career, but when we actually look at the data, we see that's not true. So I think a big piece of this is simply putting out there the reality that for the vast majority of people, getting mental health assistance is a good thing.
One of the things that I've noticed, Gary, that has changed over time, which was not the case when I was growing up. When I was growing up, we would go to the clinic on the base, and a corpsman would give me my health care. That was it. Yes. All of that has changed. Then the military treatment facilities really disappeared. TRICARE has taken over in that system. And then, of course, people either go to the TRICARE or they go to community providers. So this notion about community providers becoming more culturally competent about receiving service members for care is an important one, and that we've done a lot of work with community providers to try to build up their level of confidence and competence about asking someone as they come into their agency, have you ever served in uniform? I think that's a really important part. I think what I've also seen in the military over my very long life is that the notion of mental health is now seen as a part of readiness.
Yes.
And this whole readiness message is why it's become so important to the services. Because if the individual member and the family is ready, that means they're mentally ready. And that means they have a mental health assessment. They've been counseled or they've been trained to talk about it. So mental health is now buried really well in the groundwater of a force of readiness, which I think is a really important message.
That is. And I think it's also important that to recognize that this kind of concern about having prejudice or discrimination about mental health issues is not something that's just for the for the military. I mean, it's a public awareness issue, and I think we're all are trying to find ways to sort of make that better for people so that they will seek services, and I think it's just equally or even more important in military situations. So as we mentioned earlier, Military One Source is a great resource for help. And you'll see the contact information again on your screen. Throughout the service branches, there are several effective programs that are helping service members and their families. We're going to learn a little bit more about the Marine Corps' Exceptional Family Member Program. So let's watch.
The Exceptional Family Member Program is a DoD-mandated enrollment program for service members who have a family member with a special medical or educational need. Medical needs include not just treatment from a specialty provider, but also mental health services provided by a mental health provider. So that might be somebody who's seeking treatment for anxiety or depression or a more serious chronic mental health condition. And education includes children who are 0 to 3 years old who are receiving early intervention services, as well as children who are school age who are getting special education or related services through an individualized education program. So related services are things like speech therapy or occupational therapy or even counseling that's offered through that individualized education program in the school. Once a family member is enrolled in EFMP, they're going to be contacted by their family support provider. And that provider is really looking to establish a relationship with that family. And if the family's willing to conduct a needs assessment to determine what kinds of needs they have and whether they want to develop a service plan, that would allow us to help the family identify some goals that they're interested in achieving, whether that's through connecting them with community resources or providing them with information that helps them to become a more confident and empowered advocate for their family member, or whether that's just helping that family get connected and integrated into their community or connected with other families enrolled in the program. The Marine Corps had a study conducted, and what we were trying to get at was the stigma that is pervasive, which is that enrollment in the program is detrimental to careers. And what that study found is that, in fact, Marines who were enrolled in the program stayed in the Marine Corps slightly longer and achieved a slightly higher grade than their non-enrolled peers. And so that was a really nice empirical study that really validated the work of the program and the way that the Marine Corps has envisioned this program being developed, especially in the assignment coordination element. Assignment coordination is really the process of looking at what a family member needs in terms of medical and educational requirements and care, and then we match the capabilities of the proposed location and then make a recommendation to our manpower team about whether that's an assignment that's really going to support that family member. It's a really kind of careful matching because we really want Marines to be able to focus on their mission and on their job instead of worrying about whether their family has access to care. At the end of the day, it is a very careful balancing act because Marines are needed where the Marine Corps needs them and where they can go to a place that's really in the best interest of their individual career progression. So we have to recognize that Marine Corps needs and career progression come first, but we think we can really find a good balance to meet those two requirements and also meet family needs.
Well, it's an interesting program that really seems to address the specific needs of each family. Rachel, let's talk about an important issue that Jennifer mentioned in that clip. How does it affect service members knowing that they are leaving behind a child who is dealing with mental health challenges at home?
Right. I'm sure that's very challenging to be separated from your family during a time when perhaps there's some needs with your children and you're having to watch that from afar. I can imagine that was hard on my husband. I'm sure that it was. But I think there are some really great programs and resources that are supporting our military families. And I hope that those provide some peace of mind for our service members. You heard about the Exceptional Family Member Program, or the EFMP program. The Coast Guard offers a very similar program under a different name. We call ours the Special Needs Program. And that program really works to ensure that every effort is made that families with special needs are assigned to duty station locations where they can access the services, medical or otherwise, that they need specifically. So we hope that those families are in the areas where their needs are being well met, and that provides some peace of mind to the service members.
I think, Gary, they've also done some work across all the service components to make sure that there are trained psychologists, there are trained peer support specialists, there are trained counselors that are embedded with the unit, so that if that unit member is struggling with the reconciliation of having the challenge of leaving someone at home, that they're not necessarily reburdening the family with their concerns, but they actually have an opportunity wherever they're deployed to have a conversation with someone who is available to them, whether it's the chaplain, the psychologist, whatever it may be, that will help them feel less of this sense of, risk and responsibility and obligation when they're thousands of miles away from their family member.
As a psychiatrist, I've been deployed and have worked with service members deployed who were concerned about the welfare of their family back home, very commonly, and often because of mental health problems that they may be facing. And that's where I think EFMP is so important, because when they're in a location, their family's in a location where the services are available, they know they're getting help. Sometimes it's the provider. I'd call back and talk to the provider for their children and then relate to the service member, hey, I think they're getting good care here. That would go a long way. So I think it's really important that they have the services back home, the service member knows that, because that can put the service member at ease. Because we know family readiness is clearly part of service member readiness. And if we want the service member to be ready overseas and to do what they need to do as part of their duties, they need to know their family's okay back home. So we really see that as all part of the overall readiness picture.
And that's a very important. And we actually have questions coming in from outside, so thank you all very much. And one of them, actually, Captain Simmer, is for you. It begins by identifying that 44% of military children of the active duty force are actually under the age of 6. I did not know that. Are there specialists in early childhood mental health available? And I don't know, through TRICARE or other resources, what are you thinking about young children?
Yes, absolutely there are specialists available, and that's very important because, as we said, the needs of a 5-year-old may be very different than the needs of a 15-year-old. And so we do have specialists both in our direct care, in our military treatment facilities, who are child psychiatrists who focus on very young children. We have developmental pediatricians who can work with that group of children as well. And then within the TRICARE network, we have a large number of child mental health specialists, psychiatrists, psychologists, social workers, who work very effectively with children and families and can provide that help when it's needed.
And another issue, and sometimes it's really hard to talk about, and it's one thing to be concerned or to have a family member back home. Catherine, I think many at times we've had a number of military families that have had experienced loss, and that loss can be because of an immediate family member, a relative, because of combat, because of suicide. What are some of the issues that children go through when they experience that kind of trauma?
Well, I think we've certainly noted that much of it will be age dependent and much of it will be developmental in terms of where they are on the age spectrum and on the developmental spectrum and on the chronological spectrum. I think that any kind of loss is very difficult for any child to deal with. And oftentimes, one of the most important reactions is that, one, they have to know that they are emotionally rooted with their family unit, that there's an emotional connection to either the other parent or to the web of the family that surrounds the child as they experience this loss. And then I think there is the opportunity to have honest conversations with them as they are ready to have those honest conversations about what that means. What does that mean from the family's religious perspective? What does that mean from the family's social perspective? What has happened to this individual? Where are they? And how do you begin to frame that within your cultural, social, and religious belief set and be able to talk to the child about that? I think also there's a lot of work that has to be done about ensuring that either the child is not seen as playing a role in this. In other words, it's not their fault. It's not their responsibility. Now, what do they have to do to carry on as this family member is no longer with us? And so all of those conversations, nobody is skillful in that. We have to get help doing that, and we have to get information from the grief counselors that are offered, from some of the peer counseling support specialists, from some of the military peer specialists, to help us practice to walk through that. We're not innately born with the skill set to do that. So we've paid a lot of attention across DOD and across VA and across the community providers to say, you will need to understand trauma and the loss that comes with the trauma. And you will need to understand that people will have could have completed suicide, or they may have died in a very traumatic accident. What do we do about that? And how do you begin to open up those opportunities to talk with other family members, to get children? I mean, I think they have camps for children who have lost family members to come together and express the joy of being together, the joy of their family member who is no longer with them, and remember the good things about that family member. And I think that's really the emotional base to start those conversations.
And in terms of that being an ultimate sacrifice, we want to do everything in our power, to provide services. And let's take a look at another program that really is designed to address the needs of service members and their families. This is the Child and Family Behavioral Health System from the Army.
The strength of our nation is our Army. The strength of our Army is our soldiers. It's often said that the strength of our soldiers rests with their families. The Army recognizes that family readiness supports soldier readiness. So the Army has devoted a tremendous amount of resources establishing the Child and Family Behavioral Health System. This system of care was developed to leverage what the primary care managers, primary care providers can do as the bulk of care occurs in the Army medical homes and pediatric clinics, family medicine clinics within the Army. And we partner with them, provide evidence-based training, consultation, which is not just face-to-face, but it's also virtual. So there are multiple telehealth resources available for primary care managers in taking care of children, adolescents, and other family members. We have child and family providers available at 34 installations across the Army. So if you come to a clinic and you're asking for a referral to see a child provider or an adolescent provider, that can happen through your primary care manager, or it can even be done on a walk-in basis at many of our locations. Within 15 installations, 73 on-post schools, 3 off-post schools, we have child and family providers embedded within the school to assist not just education efforts, but also help in reducing obstacles to obtaining care, whether that's routine consultation, seeing children and adolescents when they're having a tough time, and also rendering evidence-based care right there in the school. And so in essence, we're meeting the families, we're meeting the children where they live and work. What we found is that it has reduced stigma, it has increased access to care, and that's evidenced by a large increase in terms of utilization of child and family behavioral health services. One of the strengths that Army Behavioral Health has realized in its recent transformation is the fact that standardization matters. And so if you were to access care in Korea, Alaska, Hawaii, the continental US, or Europe, the Child and Family Behavioral Health System is the same. The resources may vary based off of the size of the population supported, but the interface with the medical record is the same. The interface with the types of providers is the same. And I think that's powerful with transitions of care. When service members deploy and family members remain behind, the care continues. This system of care has outreach coordinators that leverage community assets, Army Community Services, and installation resources at those difficult times associated with the deployment of service members and also on the return. So with the redeployment, reintegration can also be just as difficult. And so mustering resources at those right times is facilitated by the child and family behavioral health system.
Wow. So one of the questions that has actually come in has to do with these services. Are they available across all of the branches? You mentioned EFMP as an example. That stands for?
Exceptional Family Member Program.
Thank you. And now that's available in one branch, but you mentioned that there was another one available from the Coast Guard.
That's right. So our DoD counterparts all access the Exceptional Family Member Program, and the Coast Guard is the Special Needs Program. Very, very similar, a few differences. The goals are the same, and really ensuring that families are assigned to locations where their needs can be met.
Mm-hmm.
I think also the understanding about sort of the military system is that there are the services, and so the service components have their own sets of responsibilities and programs, Gary, that would, and I thought the video's point about standardization was an important one, and the doctor may want to talk about that. So there's the service components, then there's DoD. So DoD has the Defense Health Agency and is responsible for TRICARE, and then you have the other components of non-military community systems. Mm-hmm. So you have almost those three pieces, Gary, that sometimes negotiating those and understanding those can be difficult, which is, I think, where the question might come from. Right. But that there is, I think it's becoming more coherent, I would say, Doctor, in terms of the seamlessness between understanding what the services offer and where their locations are, depending upon active duty service bases, where DoD, Defense Health Agency, and TRICARE are located depending upon where they are geographically in the country. And then you have community-based providers that we're trying to cultivate in terms of their openness to receiving either active duty service members or veterans if they are not near those kinds of programs.
Right. So we do a lot of things to try to make sure, as you said, that there's consistent care everywhere around the world, because we have service members and families around the world. So that's clearly our responsibility. One of the things that we do, for example, is we offer training to civilian medical providers about military culture to help them understand what military families are facing and how they can best provide their care. I think that's very important, and we're now in the process of having a certification for civilian providers in military culture that family members will be able to see on our website, hey, this is a doc who's done this, maybe I should go to them.
So that would be like a curriculum-based training activity that a provider could go through in order to get certified?
Yes,
okay.
Exactly.
Is there a place to go for that information?
There is a website for that.
Okay.
It's through the tricare.mil website, and I think that's going to be very helpful. Another thing that we've done recently is we've expanded the telemental health benefit. Telemental health is a great thing because if you have to go to the doctor's office to see the doctor and the doctor is 2 or 3 hours away, that's a major problem. Or let's say you've got a great relationship with a doctor and you're stationed at Camp Lejeune, North Carolina. You could transfer to San Diego. Now you have to try to pick up, find a new doctor, restart that whole relationship. It can set things back. Using telemental health, you may not have to do that. Perhaps you can still, see that doctor back in North Carolina even though you're in California. There are some issues with licensing and that have to be addressed, but we can do that. We now cover telehealth into the home. So you can be at home, use the computer to see the doctor through a video link, and get your care that way. We pay for that the same as we do if you actually go to the doctor's office, to make it very easy to get care. And our families move a lot, like it said in the opening. We want to decrease the stress of those moves and make those moves as smooth as possible so that it doesn't disrupt care that they need.
Well, let me just ask, because one of the things that we've heard, certainly made some news, is that sometimes it's hard to get care, or there are waiting lists for care and things of that nature. If somebody is having a challenge and they feel like they're not getting the response that they need, that they're not getting the care in a timely fashion, I mean, Rachel, what would you do? How would you help a family, make sure that they got that care?
This is a common concern. Our families move very frequently, typically. You may have established really great care in one area and you move into another area and you start calling providers, and it could be months potentially before you could get in. And that's very hard for a family that is in need of a diagnosis. Perhaps they're trying to investigate what's going on with their child, or perhaps they need the care for a need that's already been diagnosed. So there's several resources available to you. Definitely call your TRICARE regional contractor. Open that line of discussion with them. Let them know that as you're making calls to providers, there's a wait list and you need to get care more quickly. In the Coast Guard, we have health benefits advisors. That's a hotline our Coast Guard members and families can call to discuss those access to care concerns and get some assistance that way. So definitely reach out for support. And also the Exceptional Family Member Program or the Special Needs Program have points of contact and specialists available to talk to families and identify resources. So be persistent. Advocate for your family. I know the impacts that can have, but care is out there, and there's some assistance available if you're struggling.
And one thing, actually, even before we started today, Captain Simmer, we were talking about when a family is struggling and they finally find somebody and they get an appointment like 3 months from now.
Yes.
And you had a great response. Would you share that?
Sure. We pride ourselves in having a very large network of very well qualified providers. That's one of the things that we tell our managed care support contractors they have to give us, the folks who administer the medical benefit for us if we're not going to a military treatment facility. So if you go to our website, www.tricare.mil, and you can actually click on the provider directory, put your zip code in. It'll show you all the qualified providers around your home, but it'll also give you a phone number to call. So if you do get a provider and they say, I'd be happy to see you 3 months from now, and you need care before that, if you call us, we will find you a provider in a timely fashion. So we have, we have a lot of providers available. Sometimes the individual service member or family may not know where they all are, but we'll help them find them and find them someone that can get them seen quickly.
Amazing, amazing. And Catherine, before you had mentioned this idea of peer specialists.
Yes, yes.
What are peer specialists, and how do they fit into this picture?
Well, I think the term peer has many connotations, but in essence, it really does mean that you're talking to someone who's had a similar experience to you, or who has had a family experience similar to what you're experiencing, or who has a family member who has certain conditions that you want to talk about and share that information about. So in all of our systems, whether it's a military system or a civilian system or a VA system, you will find peer specialists that are cultivated in order to help you maneuver, in order to help you negotiate, in order to help you determine where are the barriers, where are the pitfalls, what are some of the things that you can do very assertively to move through some of the walls that are put up. And I think that each of the services have really committed to doing peer services supports. Each of the services, and certainly DoD and TRICARE, have committed to having, peer navigators in some places, and peer assistants, so that it might even be a service member, it might even be a family member, it might even be somebody that Rachel knows who would be helping other people that say, well, I had this experience, so I can help you negotiate the phone numbers, the websites, the connections, the contacts. There's just a tremendous power in having a conversation with a peer and with supporting each other in a peer relationship.
And how would a family member go about finding these peer specialists? I mean, what could they do? Is there a website? Is there phone numbers? Is there somebody that they should call?
Right.
They can call, they can use the website. Those are both great options, and link with someone. The phone number was on the opening, 844-357-PEER, P-E-E-R. And, that's available, and certainly would strongly encourage people to use it. If they do need services, that number can refer them to those services, help them find what they need, and get them the support that will help them get through.
Just to sort of say, some additional questions that are coming through. One of them actually has to do with, as we're looking at providers that are external to the bases and other things, community type of providers. Does TRICARE educate these providers in suicide prevention, particularly around children and teens?
So we do not actually provide that education directly, but we do credential all of our providers. They have to be licensed providers, and as part of their training before they can be credentialed, that training always includes, if they're mental health providers, recognizing the signs of suicide and how to prevent suicide.
Let me tell you, Gary, that one of the key issues for the work that we do between DOD, VA, and HHS SAMHSA is suicide prevention. And we have, as you know, at SAMHSA cultivated policy academies across all of the states. So every state has a policy academy team that has articulated a strategy for serving people in the military who live in the community and may not be accessing VA or DOD services. One of the critical subject areas was suicide prevention. And we were able to bring together the suicide prevention coordinators that actually sit on active duty assets or active duty bases, the suicide prevention coordinators that sit in VA or VISNs, and the suicide prevention coordinators that sit in state public health, state mental health, or state substance abuse agencies, or some of the local hotlines like United Way, where they would answer suicide prevention hotlines. And we brought them together to have a discussion about how do we build the capacity across a range of providers in terms of local phone numbers, in terms of 1-800-273-TALK, in terms of how do we educate appropriate suicide prevention interventions, suicide prevention curriculums across DOD, VA, and HHS. And it's one of the richest areas that I think we're continuing to cultivate, and we're continuing to explore opportunities so that we all have a language that we can share about the importance of suicide, the ideation of suicide, and frankly, the public health crisis of suicide in many ways. Again, not just the military, but it is important population because of access to means in terms of the military, in terms of a whole other set of issues. And we've been very fortunate. I'll take a state like New Hampshire. We've been very fortunate. Every single community mental health center in New Hampshire is now TRICARE qualified. And that's because the state of New Hampshire said, we don't have a whole lot of active duty assets up here. We may not have as rich a TRICARE portfolio as we want, but we're going to make sure that every one of the clinicians in our community mental health center is becoming TRICARE qualified. And oh, by the way, we'll make sure that everybody goes through suicide prevention training.
Now the number that you just mentioned, 1-800-273-TALK,
Right.
Which is a general number for the population of America.
Right.
But there's a specialized component
There is.
related to the military.
There is.
Can we talk about that a little?
Yes, there is a special key message that comes when you dial that number, and it says if you are a veteran or you are interested in talking about a veteran, please step 1. And so if you hit the number 1, you are immediately connected to Canandaigua, New York. And in Canandaigua, New York, the Veterans Administration has a tremendous range of counselors that are available. So anyone in terms of whether they're a military member, whether they are a veteran, it doesn't matter. They're all trained suicide prevention counselors, and they respond to whoever then presses 1. So it could be a family member, it could be an active duty member, it could be a veteran, it could just be an interested party in terms of a friend who's a veteran. And they're getting information right away about where they can, wherever they're located, we can get them connected to an immediate response call, an immediate connection with a local provider, an immediate connection. We've had literally thousands of rescues across that, the scope of the work of that hotline.
And I bring that up because connecting to that kind of crisis response is so critical. And just in terms of the audience, that would include a family member who's worried about their child.
Absolutely.
Sure, absolutely.
If you have a teen that you're worried about and they're giving you the warning signs or something, or actually comment that they wish that they were gone in some way, that this is a number that can actually be used all across America to connect people to resources very quickly.
Absolutely.
Yes.
Absolutely.
Okay.
It's a great service.
It's a great service, and my understanding is that it's a service that has continued to grow.
Oh, definitely.
And as more people become aware of it, and again, to get that kind of information, just even to process something like that,
Right.
and then to link up with whether it's a TRICARE provider or a community provider, those would be very critical. When you think about some of these issues and all of this, and I'll ask Rachel, we talk about our military parents and dealing with some of the challenges, and what do you think that parents can do to be proactive in some of these in these issues? So it doesn't get to that point, but maybe if you see something or you're thinking of something, what would you be recommending to your parents?
Right. I think be very tuned in to your children. Watch how they're reacting to certain scenarios. Military children face a lot of very stressful situations, whether it's moving, new schools, deployments. Communicating with them, sitting down at dinner when you can and having those conversations, and then reaching out for the resources and services that you need. Do not struggle in silence. There is a lot of growth and strength that comes from reaching out for the support that you and your children need. And there's a lot of resources available with open arms ready to care for these families. Whether it's an individual like myself, an ombudsman, someone that families can come to, ask for resources, whether it's TRICARE, whether it's your chaplain, or other services provided by your military branch. Just don't suffer in silence. Reach out for the support that you need.
Such an important statement,
Yes.
and as we're talking about this, today, to get people to feel more comfortable,
Yes.
to reach out for help. It's
Right.
part of actually, I think, what this is all about.
Right.
I think that, and sort of wrapping a little bit up as we're running out of time, but Captain Simmer, are there certain best practices that are out there that folks should think about or know about, or sort of what some of these providers are doing, or evidence-based practices? I mean, how can people be sure they're getting the right care?
Sure. Well, I think that's a great question. And I think several things. One is we do certainly have evidence-based guidelines. They're available. I would encourage people to look at those. But I think in a more general sense, you want a provider who's going to be asking you questions, who's listening, who will give you feedback. Who you can say, this is what my child's doing. And that may well start with your family doctor, your pediatrician. Hey, I've noticed this change in my child since my spouse is deployed. Is that normal? Is that something we should be worried about? And get that feedback. And then, if it is perhaps a problem, then getting a qualified provider to get help. And as I said, we have the things like the military culture certification that you can use. So there are certainly a number of ways that you can determine whether the care you're getting provided is appropriate. I think that's very important.
Awesome.
I think the DOD and VA and certainly HHS have a repository of what are considered evidence-based practices. And what are the most effective tools, what are the most effective clinical guidelines that should be followed, and that I'm sure the doctor makes sure that as people come into the TRICARE network, they can show certification, they can show knowledge of, they can show experience in delivering those evidence-based practices. And I think that it's really incumbent upon all of us, Gary, as we go into care, that we talk about that with our practitioner, and we say, what is it that you're going to be doing, and what is the trajectory you have for the care that you're going to be delivering to my child or my spouse or myself? I think those are valid consumer questions that really we should be asking.
Yeah.
And in our last, unfortunately, our time is coming to an end today. Maybe we'll try to schedule another conversation down the road. But for those watching this program and that are thinking about what to do next, what would be the one thing? You each have like 25 seconds here, but the one thing that we would want them to remember from today's discussion. Catherine, let me start with you.
Well, my one contention is that my work is to try to make sure that everybody crosses the military-civilian divide, that you should never think about military families and military people as way over here and having nothing to do with me, that we should be embracing the military community, the military families. Even as a civilian, I have a responsibility and an obligation to pay attention to those people, to pay attention to the family, to step over that military-civilian divide, welcome them, understand them, and make sure that they're connected in your community.
Very good. Captain
So,
Simmer?
I think the most important message is most military children do very well. That, we certainly talk about the challenges. I think that's important. We need to address those challenges as they come up and prepare for them. But, when you look at the studies, most children who are children of the military actually do very well as adults. And I think this is really a good news story. We have the supports in place that they need. We certainly need families to use those and identify when they need to use those. But I think the message I would like to leave everyone with is that when you do that, when you support the child through this, the outcome is almost always excellent.
Awesome.
Yes.
And as a family member and a
Yes.
parent
Right.
and ombudsman, Rachel,
Right.
we're going to give you the last word for today.
I want them to know that they're not alone, that help is available, and that we have some really great resources and services that they can access. And that parents are the very best advocates of their children. I think, parents are communicating with them, and they can really get the care and support that their children need. So, and they're not alone either.
It's awesome. It's awesome. Well, I very much want to thank everyone for participating today. Please, for a list of additional resources and the things that we talked about, to visit the SAMHSA website. We listed it, www.samhsa.gov/children. You can also go to the website for Military One Source or Be There, which are our partners in trying to make sure that we provide appropriate services and resources. And I hope that you'll all join us again on May 10th at 7 p.m. Eastern Time for a special edition of KSOC-TV, which will be part of National Children's Mental Health Awareness Day. During this evening town hall style event, we're going to go in depth about childhood trauma, its potential impact on mental health, and ways that trauma-informed care can be integrated into systems that serve children, youth, and families. So that's all the time we have for today. I want to thank you for watching, and we'll see you next time.